I have my dear friend here, Vanna, even though she called me Christopher earlier. I'm just kidding.
I sent that and I was like, oh my gosh.
I was doing homework and I saw Christopher like in capital letters, and I was like,
I
am I?
saw,
I
I
was
I was like, in my head, I saw you go.
yeah, I was like, am I being pranked right now? But oh well, here we are, everyone. I have the pleasure of introducing you, Vanna, one of the sweetest people ever. If you could please first introduce yourself to everyone.
Yeah, so my name is Vanna. I am a board certified nurse practitioner, which I think I'm the first one that you've had on. I'm so honored, but I do specialize in dermatology, but I'm certified in family nurse practitioner. But I see probably about 100 patients a week. I work 4 10s and I do see anywhere from acne to psoriasis to skin cancer surgeries, full body exams. It's funny because a lot of people, when I tell them dermatology, they automatically assume, okay, just Botox and fillers. But the majority of my practice, I would honestly say 90% of it
Mhm.
is medical dermatology, which is a lot of rashes and warts and hair loss, nails, things like that.
Yeah.
But I love what I do.
Yay. And actually, Yvonne and I got connected by Nurse Clara for the ACU, again, which was a month ago, where we talked about acne awareness. And yes, Vanna is the first NP that I've had on. My goal has always been to talk with an NP, but I've always envisioned it to be someone from Derm. So there's so much misinformation on the internet about every field in healthcare, and especially skin. We see all the time, right? Even on like TikTok or Instagram, there's these hacks and whatnot. And sometimes they just make you think, wait, this is so unsafe. I am so worried for this person. So why don't we bring on the experts like yourself to talk about it? And like I said, the first one from the nursing field, I wanted to ask, how did you get here in your journey, like education journey? Obviously, you were an RN before, right? You were a nurse before.
Mm-hmm.
So can you please tell us and all those aspiring pre-nursing students and nursing students?
Absolutely. So I did. I got my bachelor's in nursing, and there's actually a lot more flexibility because you have people out there that do want to pursue, but they are a mom or a dad, or they have to work full time. They can't just go and, get their bachelor's. So there's a lot of different ways these days that you can, obtain your RN. There are bridge programs. But I got my bachelor's in nursing, and then I worked in the field for a couple of years. I actually worked in the NICU for about a year. Yeah, I loved
Wow.
it, honestly. Adults in the ICU setting terrify me, which is hilarious because I get the opposite from people that work with adults. They say that
Yeah.
babies in an ICU
Yeah.
terrify them. So yeah, I worked in NICU, and then I actually became an RN in dermatology. And I
Mm.
think that was my saving grace in becoming a provider in
Mhm.
dermatology. I get so many questions of how did you even get into the field? And I got into the field by getting my foot in the door. And a
Yeah.
lot of people come to me wanting to be a provider in
Mhm.
dermatology, and that's being an NP or a PA. So I think that you can get your foot in the door, let people know who you are, your work ethic. They get
Mhm.
to know you, they get to love you, and then you can be hired on as an extended provider. And mind you, there's different things that you can do. You don't have to be an NP. If you
Mhm.
got a bachelor's
Mhm.
and you still want to go into the field of medicine, you can
Mhm.
be a physician's assistant,
Mhm.
or I think it's associate now, right?
Yeah, associate. Yeah,
Yeah,
associate.
physician's associate. So the practice that I work for, we have an equal number of PAs and NPs. We
Mhm.
both do the same thing. I
Mhm.
know the scope of practice is different by state, but we're supervised by an MD or DO, a
Mhm.
medical director. Yeah, my journey was actually pretty cut and dry, but I mean, for people aspiring to be in the medical field, there are so many different
Mhm.
ways that you can get there these
Mhm.
days.
Mhm.
You just got to start.
Yeah, and I'm so curious, where did this love for healthcare started? Did you always want to become a nurse? Like, we've heard those stories. I've always wanted to be a nurse. Was there anyone in the family or friends or personal experience that you were like, oh, I'm gonna be in healthcare one day?
For sure. Since I was in high school, I always wanted to
Mhm.
be in medicine. Actually started college pre-med. And I think people get that a lot. And I have so much respect for physicians, but I also am very thankful that I chose the route that I did because, I mean, I have the flexibility to go in between specialties if I would like. I have a supervising that I can always, and my supervising physician is amazing. I have her to lean on, to mentor me, or to ask her questions. And I also don't have the malpractice on me. Being honest here.
Definitely.
Wrong in medicine. So there are definitely benefits to being an extended provider. But yes, I grew up with many family friends being doctors, nurse practitioners, and it wasn't always necessarily nursing. But once you do get into the field of nursing, you just have something ingrained in you that you're so proud to be a nurse, and your family and your friends are so appreciative and proud of you as well. It's definitely a very, very rewarding profession to be a part of.
I agree. You know, I do have students who, either high school students or college students, who message me on YouTube or Instagram. They're like, I don't know what to choose. Should I go the pre-med route or the pre-nursing route or the other routes that there are, right? And I think it's so great that we are in a generation where we have options, right? We have options. There's power in having options. And I love what you said, everything like flexibility. I get that a lot too, or my friends get that a lot too. They're like, oh, why didn't you become a doctor? And some of them will just plainly say, I don't want to be a doctor.
I don't want to be.
I don't want to be a doctor. Because I have friends who want to start families early, and as we are aware, the road to medicine, the life of a physician is
hard. And that's why I have so much respect in it. Is I have no doubt that if I really wanted to, if I wanted to take the MCAT, if I wanted to go to med school, I have a very determined personality. I am a smart person. I'm not saying that like boastfully or conceitedly.
But we have to be smart, right?
Yes. But like kudos to them, because I mean, my sister-in-law, she's an orthopedic surgeon. And just the things that, you know, I've heard and seen, I'm like, gosh, like it's very, very hard. But I mean, it's rewarding for them too. But I'm happy because I was able to start a family and I had the flexibility of while I was getting my master's, I still work part-time. And it's just totally different.
Yeah. I agree. And being the first nurse practitioner on my channel, I'm thinking like it's a TV show. On my page, it is a TV show. Welcome to the show. Can you explain to those who may not know what the role of an NP is? Like the study route, I know there are masters and also doctor prepared NPs. So if you can explain to us the studies to get there, the training, and also what is your scope?
Sure. So you do as a nurse practitioner, and it's different for physician associate, but for nurse practitioner, you do have to have a bachelor's in nursing to be accepted into a master's program. So basically, I did 4 years of undergraduate, had obtained a bachelor's. It's different these days, though. I mean, it was up and coming, I feel like, when I got my bachelor's, to where you can do like your bridge to RN, like BSN. Yeah. So I obtained my master's, which took about 2.5 years. And I could have kept going and doing doctorate. Doctorate was actually an additional year, but in my mind, and it's different for every school, but in my school, it was roughly 2 years for a master's and then an additional year if you just kept going through. But like if I went back at this point, I think I would have to do an additional 2 years to get a doctorate. So it's a master's in nursing. It's the same way with physician associate. You have a bachelor's, you have to meet the prerequisites to get into PA school, and then you obtain your master's and you're able to work under a supervising physician. So my scope, and it's different state to state, but honestly, I could open a practice as long as I have had a medical director to check my charts, make sure, you know, I was abiding by the law. I could open my own practice if I wanted to. I do not want to do that. I love the practice that I work for. I love my supervising, but I do, with the exception of, so in dermatology, there's medical dermatology, there's cosmetic dermatology, and then there's surgical procedures, and more specifically, there's a procedure called Mohs, micrographic surgery. You do have to have a fellowship in that because you have to read slides as a dermatopathologist. So I do the same things and have the same scope of practice and see the same types of patients that physicians see with the supervision of my supervising physician.
Actually, I've gotten a lot of questions in that when I started promoting our live is there a point or is there a case or a condition that you see within the field of dermatology where you have to refer the patient to the supervising physician, like other than procedural stuff?
Sure. No, I've never had to just pass on a patient to my supervising. More of the way that it works within our practice is I'll see a patient at 3 times. And if within 3 times I'm not getting them better or it's not quite responding to therapy, I've done a biopsy, I've done lab work, I've done all the diagnostic things that I do, and for some reason they're just not getting better, I will pull her in. She comes to our locations. We have a couple of locations. She comes to each location frequently, and she'll see the patient with me, work through that with me. But there's never a time where I just don't see that patient's care through.
Got it. Yeah. And I feel like though the role of NPs are not new whatsoever, I feel like a lot of people still do not know much about it, right? Regarding the extensive education and the training, all the clinical hours that you do before you even sit for the boards, right?
Yeah, exactly.
And I wanted really to delve into that patient room. So like you said, 90% of what you see in the clinic are very medical, right? And you enlisted them like acne or psoriasis or even eczema. Is there one condition that really impacts you the most as an NP in dermatology?
For sure. I mean, it's definitely acne. And I work with a lot of different providers that don't like acne. It's just, I feel like I get so many acne patients. They're drawn to me.
Yeah.
And I love to treat it. I love to educate patients on it. I love to go through with them how we're going to get them better, the background of acne's etiology, things like that, and then walk them through their treatment. I mean, I treat so many different things, but I would say that that's the one thing that when I see that on my schedule, I'm thinking, oh, this is something that I love.
Yeah, and we talked about this a lot. Like, there is a psychosocial department and aspect to not just acne, but dermatology as a whole. There's a lot of stereotypes and bias against different fields in healthcare, right? And even dermatology is not immune to it. Like you said earlier, people think it's just a glam.
Oh, yeah.
Glam and glamour. Oh, Botox, fillers, liposuction, nasal fillers, all these things. But they're forgetting the medical aspect of dermatology. Like people who have lost hope because they see themselves as, oh, I'm not wanted. Oh, I'm ugly because of my skin condition or whatnot. And how do you compartmentalize that as a provider? I guess like a patient is crying in front of you because of their skin condition. How do you separate the, oh, I feel so bad too, this is what we're going to do?
Yeah, I actually had to do that recently. I had a patient with pretty bad hair loss. You think about it, put yourself in their shoes. If you're all of a sudden just losing clumps and clumps of hair, I mean, you have to empathize. You have to connect with these people. You have to understand why they feel the way that they feel. But the biggest thing that gets us through care is, hey, I hear you. People can walk into a room with a medical provider and probably tell within a few minutes if they truly care and are connected with you or not. So hear them out, listen to what they have to say and say, this is what's going on. Explain to them, because a lot of times in their mind, they're thinking, how did this happen? Why is this happening to me? Go through that with them, whatever it may be, and then say, this is how we're also going to get you better. And really, truly explain that, because I can't tell you how many times I've had patients come to me, family members, friends, say that I went into a medical provider. Doesn't have to be a dermatologist. I go into a medical provider and I walk out thinking, what just happened? They just came in and they went out, didn't talk too much to me. And there is a delicate balance, because you want to see a certain amount of patients and reach a certain amount of people and help a certain amount of people. You only have a limited time to do that. So it's like getting in that room, really connecting with them and explaining their plan of care in an efficient way.
Yeah. Like I told you before, the very first dermatologist I went to for my acne literally was seated down with the medical assistants, right? Took pictures, asked me, have you taken this or that before? Dermatologist comes in, they look at me, and I just told my story that, oh, I really want to get this better. And after 1 minute, she already had the regimen without even touching my face. Didn't ask me, oh, when did it start? How does it make you feel? Or whatnot. And within 5 minutes, I was out of the room with a prescription already. That's why I love talking to you because you always talk about this. There must be that connection with patients where they need to know that you care for them. I love how you really develop this patient and provider communication and connection because I feel that's also key in the success of the treatment, right? Why would I do this if I don't trust who is telling me to do it? Right? Am I confident that I'll actually get a follow up? Will I get actually solid advice? I mean, there's no perfect physician. There's no perfect NP or PA. You just need a physician or an NP or a PA who knows what they're doing and actually cares for their patient, right?
Right.
And actually, a lot of questions also came about hair loss. As the one who's treating it, how do you attack that? What is your starting point with, oh, I have hair loss. This is our treatment plan?
Yeah, and I can't imagine hair loss. I actually did. I had postpartum after my
Mm.
had it really bad, but hair loss is a whole different beast. And it's funny because people will come in for acne or full body exam, and then at the very end they'll say, oh, and I'm losing a little bit of hair. And I'm thinking, this is a huge appointment. Hair loss, I will go over all of the different types of hair loss. I'll assess your type of hair loss, ask you questions about stress, about, recent events, medications, things like that, and then try to clinically say, okay, I think it could be these types of hair loss for you. But also key things in hair loss are a biopsy and also lab work. So extensive lab work, making sure nothing internally or systemically is causing that. A really common thing is your thyroid or like an autoimmune type of disorder. If I look at your scalp and your follicles are inflamed, there's a possibility of an autoimmune type that's called lichen planopilaris. There's so many things. And I am very much OCD type A of, hey, we're going to figure out what type of hair loss you have. And it may simply be telogen effluvium, which is stress. It may simply be male pattern, female pattern hair loss. But either way, you treat them all differently. There's a specific way that I treat orally or topically. And we need to figure out and get to the root of the issue to be able to correctly treat you. And I think that patients want that. I think that they would want me to go through that process rather than say, oh, here's some minoxidil, here's some Rogaine. You know what I mean?
Yeah. I agree. And actually, I'm curious as to your thoughts on over-the-counter creams that we see in Walgreens or whatnot, medicated formulas that are non-prescribed for hair loss. Do you think there's a point where, oh no, you have to see a provider for this?
Oh, I definitely think there is. I mean, period, I would see a provider because there are prescription strength medications that will help with your hair loss, and they're not necessarily long-term. For instance, telogen effluvium, which is stress-related hair loss, you can get that after any type of traumatic or stressful event. Some people I'm seeing are getting it from, medications. They get it postpartum after having a baby, or they just had like a family member pass away. It can be anything, but it will correct itself once the stressful event is reversed. We figure out, okay, what is the root cause of this? It'll correct itself on its own, but there are things we can do to help speed that process up. It is good to use minoxidil. It's not going to hurt to use minoxidil, which is the generic of Rogaine. I will tell you, marketing, it is more expensive. I can't remember. One of them, men's and women's, one's more expensive, and they're the same thing.
Yeah, I know.
It's insane. So it's a less expensive one, people. But yes, I do think there are some times where in the regimen, I will do minoxidil. I will say that I don't do it solely by itself, but I think it's a great place to start. But then again, when you're coming to me as a provider and asking me for help, I'm not just going to recommend over the counter things. I usually will give you a prescription because it's
so there are new things like PRP for hair loss, right? Do you also do that in your clinic?
Yeah.
Oh, you do?
Yes.
So can you explain to people who may not be familiar with PRP and microneedling? It's like the new miracle of the century, right? Everyone is getting microneedling. Everything for acne, for hair loss, for scars.
For under the eye, dark circles.
Oh
yes. So PRP has actually been used a lot. Basically, what you do is it's a lab draw. We spin your blood down and get the platelet-rich plasma. That's the PRP, the platelet-rich plasma off the top. And then for hair loss, specifically for female male pattern hair loss, we inject it in the areas and it stimulates. It uses those stem cells, the growth factors, for you to have new new and honestly more rapid hair growth. And I've done it on a good amount of, honestly, I've done it more on men than women. And we've had very good results. Typically, you'll have injections every 4 to 6 weeks. It's optimal for 4, every 4 to 6 weeks for anywhere from 4 to 6 months. And then you can also maintenance it. But we have done befores and afters, and we've seen great results. I've actually done it in a male's beard, and had really good results too.
To grow out the beard.
Yeah. For like bald patches.
Oh, got it. Wow, that is amazing. See, this is the thing. You can have the best of both worlds. You can get lasered to get the hair out, and then now you can get PRP with microneedling to actually let it grow. It's amazing.
Whatever your heart desires.
Whatever your heart desires. Is there one procedure that is your favorite that you do in your clinic by any chance?
I really love, and it's funny because it's cosmetic, I love PRP under the eyes. I really love surgery though. So we excise skin cancers, we excise cysts, lipomas. I think everybody that gets into dermatology doesn't realize how much they will love surgery or how much they'll actually do the surgery, because you know, we see full body exams or people come in and say, I have this spot and it won't go away. You biopsy it, it ends up being a basal cell carcinoma, squamous cell carcinoma, or even a melanoma. And at certain staging, we can remove melanomas. So I love doing excisional surgeries.
Amazing. You know, like you said, there are medical and they're just pure cosmetic procedures. Like, let's get into the topic of Botox, the thing right now, which I plan on getting for my forehead because I just have this.
I'm toxed. I'm really toxed here.
I have like this little line because I'm usually like, what were you saying? So
it's just how you are. Yeah.
Yeah, but then my skin is like, okay, we'll give you a souvenir on your forehead. And can you explain how Botox works?
Yeah, so Botox is, when you think, because I do get that question a lot, the difference in Botox and fillers. So Botox is a neurotoxin, and basically what it's doing is it's relaxing the muscle. Some people like to say paralyzing. I think that sounds harsh, but I mean, it's relaxing your muscle, breaks down acetylcholine, and then it takes about 3 to 4 months, depending on how you dilute it. Botox is also a powder. It has to be diluted. So some people will say, oh, they dilute their Botox. You have to dilute Botox. It comes in the form of a powder, but it usually lasts about 3 to 4 months, and that's how long it takes to build back up. Another common question I get is if you get it once and you never want to get it again, it's not going to make anything worse. So typically I'll have patients that get it around special events if they don't want to do it every 3 to 4 months. But basically what it's doing is it's relaxing your muscles. I'm not the best example because I regularly get Botox, but in places like your forehead, when you raise your brows, the frontalis is the only muscle that's going to raise your brows, and that's where you get these horizontal lines. So in adding Botox, what we do is we relax that muscle. There is an art to it though, because if you just do too much, I mean, you'll get where you can have that heavy, brow. I have patients say, I never want my forehead injected again because I got it injected and I felt like it was so heavy. You might have been injected a little bit too low or dosed a little bit too high, but done nicely, it just relaxes the muscle in your forehead and your crow's feet, your bunny lines, and in the infamous, or actually I like it, so I think it's the famous, the lip flip. If you have a gummy smile, you can inject it to lower so you don't see as much as that gum. I think it's the best thing ever.
Yeah, and people don't see how it goes even beyond just the cosmetic part, which I actually want to talk to you about is, for example, I know for some TMJ, right, they can do Botox to relieve the tension, even hyperhidrosis for like armpits, right? And this is a question that came up a lot. Do you think that there is a fine line, especially in the field of dermatology, is there a fine line between vanity and medicine? Do you think cosmetic dermatology is just pure vanity, or is there something more to it?
No, I don't think there's a fine line, and I think you'll find people that disagree and providers that disagree. But here's the thing: if you restore someone's confidence or their joy, if they feel better because they don't have wrinkles in their forehead, great. You know what I mean? You're increasing their quality of life, whether you agree with that or you don't. But then when it does come to the hyperhidrosis, I mean, people do have the excessive sweating where you can inject Botox in the palms. I've done both. I've done palms and I've done axilla or armpits. And they're able to wear white shirts. They're able to wear certain tops that they were never able to wear before. Or men that are just like soaked. I mean, and I've done men and women equally. It's not one versus the other. That's improving their quality of life. I don't think there's a fine line. And if it is solely because in your face, because you look and you feel better, then more power to you.
Yeah, I feel like some people either don't understand or really underwhelm the power of confidence, right? The fact that you can go outside, full smile, wearing whatever you want. Even me sometimes, like I do sweat a lot, like in my armpit. Sometimes I'm like, oh, I can't wear a gray shirt, especially during summer.
Embarrassing, yes.
Because you don't want to be walking and you have like 2 spots of like on your shirt that's like darker than the rest of your shirt, right?
Yeah, for sure.
So I love what you said about the power of confidence. And I feel like that alone really gives a statement on how much dermatology can change a person's life. And that's why I can't imagine, or I can imagine how fulfilling it is to be a provider in dermatology. Even for fillers now, how about fillers? Is there something outside pure cosmetic where fillers can help?
I mean, yeah, I've done filler and Botox on stroke patients or patients that have to correct that.
Or resorption.
More symmetry, yes, or like Bell's palsy. There have been people that have gotten in accidents. You know, they had screws in their foreheads and they, you know, want a more even forehead. There are definitely things that are, I mean, they're still, I guess, considered cosmetic, but it's not just, oh, I want to be, you know, it's not a vanity thing. There's something that's preceded this and happened in their life.
Yeah, and I think it's also what media has done, right? They place so much stigma on cosmetics when it shouldn't be. Like, and also if a person wants to have something done or added or removed on their face, right? Like, why not? It's their money. It's it's their skin. But as we already have explained Botox before, can you explain how filler works?
Sure. There's different types. The main type that I work with is hyaluronic acid fillers. That's a natural substance found in your body. But basically, it's like in a gel form. And when you think about fillers, you think about augmentation or correction at like a static line. So when we fill the nasolabial folds, that is from the muscles. But once you've gone so far, you correct it with Botox as much as you can, but then you have those lines at rest. We can take filler and restore. You have fat pads, and those fat pads move around as we age. Gravity takes a toll. So we can put the cheeks back. We can put the chin back. I honestly, even though I have Asian in me, Asians have very flat features.
Do you have Asian in you?
Yes.
Oh, yeah. I didn't know.
That's why I'm so involved in ACU.
I know. I was asking her. I was like, she Asian.
Yeah. Well, and it's Chinese. So it's really Hawaiian. I've always identified as Pacific Islander because that's where I was born in Honolulu, Hawaii.
Oh, wow. I love it. Oh,
yeah. I did genetic testing and I am 46% Chinese. I know.
ACU percent.
I know. So basically, and as you know, Asians have very flat features. And all the rage now is the cheekbone, the brow bone, the chin. So we can take fillers and augment where that bone would be. It's essentially changed like the shape of the face.
Yeah. You know what I was really surprised about is nasal fillers. Where if a person doesn't want to do rhinoplasty, right, you can actually just like contour your nose and in that way. So it's great. It's amazing. And I love how open you really are talking about Botox and fillers. And I think that's something that we have to change in this generation too, is trying to get rid of the stigma around it.
Yeah, especially because you have these people that are getting these procedures, these injections, you know, using filters, but they're not owning up to that. And then the people that are thinking, well, I don't look like that. Well, they look like that because they've got injections. Like, don't tell me, don't go on. And you see, I'm making facial expressions. I'm able to move
Mhm.
and it's very natural and subtle. But if I were to come on here and say, yeah, it's the
It's,
Asian
I,
glow.
I was born like I woke up like this.
Yes, no, like share your secrets. It's always been a taboo or a tell all,
Mhm.
and I've always been a tell all person. But it's like when people ask me, like, oh, how do you do this? I'm like, well, it's equal parts skincare, Botox,
Mhm.
fillers, and medical procedures, you know?
Mhm. I think that's a very crucial part too. So you talked about skincare. We talked extensively about this before, but let's move out of the realms of just acne. I feel like 2020 was the year of skincare.
Oh,
It's
yeah.
the pandemic. Everyone was home. Everyone was trying new things. And I feel
Mhm,
like some people do 4 different skincare. And then because there's so much, they don't use it, right?
mhm.
But since everyone was on lockdown during the pandemic in many parts of the world, they got to use the things that they bought from before. I was like, even my mom, she was like, "Oh, I didn't know I have this." I'm like, "Well, first check the expiration date, and also two, you have so many things.
Mhm.
Like she has different types of things. If there's one part of the skincare, whether it's cleanser, toner, feast, toner, actives, or whatever, what is your favorite part of your skincare routine?"
I would say there's two answers,
I
two
knew it.
parts,
You can't
two
just say
parts
one.
to that question. And I feel like people think that derms like use this as a cop out. I think actives are the most fun. That's the most enjoyable part, okay? But the reason you are using those actives is because of oxidative, environmental, and sun damage.
Mhm.
So the most vital part of your skincare routine is sunscreen. And I know that people are like, oh yeah, dermatologists, they won't stop talking about sunscreen.
Yeah. Yeah.
But it really is really important. And it's even important in acne. It makes your dark spots fade quicker.
Hmm. Hmm.
I will say the funnest, the most rewarding products are going to be your actives,
Hmm.
but you're going to save yourself a lot of time and money if you do a sunscreen.
Sunscreen, yeah. I feel like with sunscreen, people just automatically equate it to like skin cancer. But there is more to that, right? Like
Yeah.
most of wrinkles are caused by long-term UV radiation.
Yeah, I have so many people that will come in and they'll say, okay, what lasers do I need? What
Hmm.
skincare, what vitamin C serum, what, retinoid? And
Hmm.
I'll say, first and foremost, if you're investing your money in all of these medical procedures or any of these products, but you do not have a good sunscreen, broad spectrum on board, you're wasting your
Yeah.
money. There is the skin cancer side of it for sure, because that UV damage does alter the basal and squamous cells of your skin.
Hmm.
But the majority of the fine lines, the wrinkles, the pigmentation, the uneven texture and tone, it's from the sun,
Yeah.
environmental and oxidative damage. Like I feel like I'm beating a dead horse all the time
Yeah.
when I talk about
Yeah.
it and people like roll their eyes, but it's
Yeah.
so true.
Yeah. Isn't it funny how people spend so much time and money and resources to reverse things when you
Mhm.
can just prevent it in the first place? That's why I love what Susan always says, like Susan Yara, that all of your other skincare parts are useless if you're
Uh-huh.
not wearing sunscreen, which is so true.
Absolutely.
And July is UV Safety Month. We did a feature on ECU, and it's so true. And I agree with what you're saying about beating like a dead horse too. And this is why I also started the show about the misinformation. There's so much misinformation on sunscreen online, right? Oh, it's not needed. Oh, it will give you cancer because
It'll kill you.
it will kill you. It goes into your bloodstream and it will make you toxic and you will die. As a provider who studied and trained and sees patients and learn continuously in this subject matter, how do you combat misinformation like that? Do you target it head on, or and how does it work? Let's say if a patient comes in and says, "Oh, these are what I've read."
Mhm.
What is your view?
I actually encourage it. I love to educate patients. I don't shy away from it. They'll come into me and they'll say, I recently just had someone come into me and they came in for one thing and they said, I know that you're supposed to go to the dermatologist and they're supposed to do a skin exam and
Mhm.
check you for skin cancers and pre-cancers, but I mean, I'm just not worried about that. As I was looking at him with all of these pre-cancers all over his face, and I was thinking, we should be worried about it
We
because
should
those
do it.
turn into skin cancer. But yeah, when they come in and they say, this is what I think, or this is what I've read, or in my
Mhm.
mind, this is how I think about it. I say, yeah, you tell me everything because I
Mhm.
don't want you going to these forums, these discussions,
Mhm.
Dr. Google.
Yeah.
I want to be the one educating you and telling you
Yeah.
what I have learned in my practice, in my
Mhm.
schooling,
Mhm.
and I love conversations like that.
Yeah, which is great because there's always a new myth every single day, right? Especially around skincare. And I don't know if you've seen this, but I think 2 nights ago on TikTok, it blew up about retinoids. How
Yes.
there was one where it's like, tell me something that you didn't know. And then the second clip was this guy saying, oh, you should stop retinoids because my psychiatrist said it's a depressant. And it will call you to, commit suicide, which is literally against literature and all the articles that we have. As a master in this field, please clear the air for everybody.
I mean, honestly, and the other thing about like retinoids will thin the skin out when
Oh,
that's
yeah.
actually the opposite. It stimulates collagen
Yeah.
growth and increases elastin. So, and there are actually research studies on that.
Yeah.
But then as far as, I honestly find that retinoids increases people's confidence and it actually does the opposite. They feel better about themselves.
Yeah.
And people that make those types of claims, you've got to look at the big picture. So in saying, okay, what was really going on in your life? You may have started a retinoid and then a family member died, or you went through a breakup or something.
Acne itself can cause depression.
Yeah. Oh, yes, absolutely. And that's why, I do prescribe Accutane. So I have patients come in and there is that, mood change component of Accutane. But I tell people, yes, that is a possibility. That is a possible side effect. I will monitor you very closely for that. But I actually see the opposite of it. It actually, people's skin starts improving. They're feeling better and they are more social, or, they're not as depressed or anxious about the way that they look. So there is nothing that can medically research tie depression, which is a psychological issue from a topical medication.
Yeah. And not to discount the psychiatrist training who did that, but psychiatrists are masters in psychiatry, right? This is why it's so important to listen to the ones who are in the field of dermatology, because retinoid is within the bounds of dermatology. And also, all these myths and misinformation that we see online are from isolated cases, right? This is what happened in this one person who used it, and then people want to generalize.
I'm thinking like Accutane is considered a retinoid. It's an oral. It's an oral retinoid. So I'm like, is that where you were going with that? Because the topical version, no.
Yeah, I agree. Because we see everything, oh, it goes into the bloodstream, so it's going to make you depressed or whatnot. Despite the lack of literature, scientific literature in it. This is a good thing about social media as well. It's a double-edged sword. We see this misinformation here, but we also have the chance to clear out this misinformation with social media itself too, right? And with all that happened last year, the pandemic, it's great how we all connected, right? Online, and everyone's working together to fight misinformation and all of that. And back to retinoids, though, what a lifesaver, right? What a lifesaver.
Gold standard.
Gold standard. I can't imagine life without retinoids right now. Some nights I'm so lazy and I get so tired and I fall asleep without putting my retinoids on. I wake up in the next morning, I was like,
yeah, you see that this hyperpigmentation right here and right here. I went to sleep without washing my face and doing my tretinoin, and that's what happens. That's the price you pay.
Yep. And within dermatology, we can't avoid skincare. That's where it's rooted from, right? And for sure, your skincare is optimal because this is what you see every day. What are your top ones or two do's and don'ts when it comes to skincare?
Definitely always have a sunscreen, but then for your actives, you're going to want a vitamin C in the morning and then a retinoid at night. Some people can be sensitive towards vitamin C, so anytime you incorporate something, do it one thing at a time because a lot of people get ahead of themselves. They want this 3 to 5 to 10 step routine.
Yeah.
You get irritated and you have no idea what caused that irritation. But the biggest education should actually be with retinoids because it is going to exfoliate the skin. It's increasing your cell turnover rate. So you've got to make sure that you are connected with someone that's going to educate you properly on how to incorporate that into your routine. But definitely make sure you've got the right actives and then take it slow. You don't have to have a million steps, especially for acne. I think minimal is even better.
It's key for acne.
For sure, because you can actually cause acne with too many products or too irritating of products.
Yeah. And when it comes to retinoids as well, another misinformation that I've seen was how it causes photosensitivity. That's why derms say not to use it in the morning. But actually, it's the other way around, right? It gets broken down by the sun. That's why you don't want to use it in the morning.
Exactly. Yeah, and it actually is. It's produced in more stable forms these days, so you can't even use it in the morning. I have people with really bad comedonal acne, which basically requires a retinoid, and as their skin tolerates it, I always increase them to twice a day. You do think of it as a rule of thumb to use it at night, and there's really just keeping it simple to not change that. There's no reason that you can't do that in the morning. But either way, even if you're using a photosensitive product and you've got a good physical sunscreen block.
Yep, I agree. And I feel like also this year what came out is the retinoid alternative, which is Bakushio. What do you think of it? Actually, I haven't read much about other providers talking about it.
Yeah, they're still doing research on it, but the research that they have done is shown to have the same benefits of a retinoid. So I think if you can't tolerate that, or you even are pregnant or breastfeeding, it's the perfect alternative. I honestly recommend bakuchiol or azelaic acid. We have a little bit more research and understanding of azelaic acid, and it does wonders for rosacea as well. But I do think bakuchiol is something that's very up and coming. It's something that we should pay attention to and consider for very sensitive skin types or people that are pregnant or breastfeeding as a retinoid alternative.
Got it. Yeah, I mean, the world we live in, right? There's a new ingredient almost every day, different plant extracts.
There's so many, yeah.
So many. I am gonna name a few, some of which is so mainstream. I just want to hear your thoughts on it.
Yes.
Chlorophyll. We've seen this. What do you think of
there are some things that I'll see it and I'm like, well, I don't really have an opinion on chlorophyll. I stick to what works, what is in the literature, what's researched. I'm not opposed to, looking into things and trying new things. But there are some things where I'm like, oh, that's just not really worth my time right now.
How about niacinamide?
Oh, love niacinamide. So that's another up and coming star. I think we talked about this on the Acne ACU Live. It's great for sensitive skin types, and a lot of pharmacies are compounding it into retinoids to counteract and balance the irritation from those.
How about AHAs versus BHAs? Is there one you'd prefer, or you think they're used for different things?
So they're used for different things. Sorry about my dogs. This happens every time.
I know.
My husband takes the kids away, and then he brings them back, and they chill outside, and this happens. But anyway, okay. So AHAs and BHAs. BHAs is like your salicylic acid, and that's more for clogged pores, blackheads. It's really going to get deep into the pore and clean out that keratinous debris. So it's really good for acne skin types. It can be a little irritating though, so you have to be careful with it, especially in the form that you use it. And then AHAs are like your glycolic, malic acids, lactic acids. Those are more for evening, brightening a skin tone. It is exfoliation, but I think of that more for hyperpigmentation or livening up dull skin.
And a lot of people have asked, can they use acids while on retinoids, or is that too sensitive for them?
So you definitely can. You have to be careful. I wouldn't put on a salicylic acid or glycolic and then follow that with a retinoid. I definitely think that you can have both. I actually use glycolic in the morning, AHA, and then a retinoid at night. You can definitely combine them, but you always just listen to your skin. Your skin's going to tell you if you start to get that, itching, burning, red feeling, then it likely is that your skin is a little bit too sensitive. But you can always work your way up to it. A lot of these actives and active ingredients, they're increasing your cell turnover rate, they're exfoliating, so you're going to get a little bit of peeling with it. But when you start to get the redness, the itching, the burning, your skin's saying, whoa, this is too much.
How about clay masks? Do you think it's too heavy on the skin?
No, I think masks are great. I don't do a ton of them because I feel like I don't have time for them.
You're so lazy.
But in a perfect world, I would love to sit around with a mask on.
I think it's a luxury, right, to put a mask on. It's so much
I think clay is very detoxifying.
Yeah, because it's like you gotta put it on, you gotta wait for it to harden. Then the hardest part is actually taking it off with warm water, and it's just so much time. How about nose strips? Do you believe in nose strips?
So it depends, because first of all, you have to be very careful. I mean, you don't want to be ripping the first layer of your skin off. It will clean your pores out. I think it's a quick fix if you've got like an event or something that you're really trying to prepare for. But ultimately, the best thing is going to be your BHA and your retinoid to clean those pores out and keep them cleaned out. I think that's a common misconception as well, that, oh, okay, I'll just spot treat or I don't have to continue my actives. But it's vital to continue those to keep the pores cleaned out.
We talked about this before too. Vitamin C.
I love it.
I love it. Give me all the brightening stuff.
Okay, typically vitamin C. Vitamin C is an antioxidant. It reverses and prevents oxidative damage from the environment, from the sun. So basically, you think of this as evening, brightening the skin tone, reversing hyperpigmentation. It does have a little bit of an exfoliative effect. The best type to have is L-ascorbic acid. It doesn't stay that stable though. So you've got to make sure you've got a good reputable product, because if you've got one in the wrong packaging, it can oxidize very quickly. You always want that to be like a clear yellow tint. But if you start to get on the side of orange brown, the product is oxidized and it's just not effective.
Yeah, and I also love it when vitamin C's are formulated with vitamin E and ferulic.
Makes it more stable.
I feel like it adds to the stability of the vitamin C itself. Because I used to use one brand of vitamin C before SkinCeuticals, the gold standard. And when it comes, it's like oxidized right away. And like, this cannot be it. And last one, chemical peels. So do you think of chemical peels like DI peels? Do you think it's a routine thing that should be done? Do you think there's some people who shouldn't even get chemical peels?
So chemical peels, I love chemical peels. I'll do them a couple of times a year. I think it's a good maintenance or a good add-on. But it should never be in place of skincare. So I have a lot of patients that will come in and they'll say, oh, I've been treating my acne with peels. Peels are not going to help your acne. It may help with the pigmentation, you know, the dullness of your skin. But I do think that it's a great, add-on to skincare to do every, twice a year, quarterly. So you've got like your glycolics that will give you, a more even skin tone, or like a VI peel that will reverse melasma very well. So I think that they are a good adjunct to skincare, but not solely for, treating certain conditions like acne or hyperpigmentation.
And we talked about this too. Acne, because of the inflammation, this is causing the hyperpigmentation, right? You talked about PAH and PIE before. Like, you're going to treat it at the cost. You're going to possibly help dry out the acne, but it will come back. And the inflammation will get worse. And your hyperpigmentation will get worse. But I do love VI peel. I have tried VI peels multiple times before. It stinks like crap. But it's so good.
It's formaldehyde in it.
Yeah, I think so. Yeah. And you look like a snake, literally, for 1 week as it comes out. But you do feel like a new person.
Yes, last year I did it around Halloween. So it was perfect. But yeah, anytime I do a procedure like that and I come home, my husband's like, what? Fun.
I went to, back when I was in nursing school, I had a VI peel and I had clinicals that week. And obviously there's no masks during this time. So I went to clinicals and my face like peeling, and all the patients were like, wow, you look like a snake. I was like, wait until the 7th day. I was like, the Lord's Day is in the 7th day. Wait for it. I'll be a new person. I do love VI. And what I also love is talking to you all the time. Your work as an NP is, especially in dermatology, it's a lot of work. It's just beyond the cosmetic and the medical and the procedural. A lot of it is emotions involved, right? Especially when it comes to patients. They come into the room, open up to you within a matter of seconds, and they trust you, and they entrust you with their stories. How do you decompress out of work? What do you do outside of work that's like, I'm not at work right now, I'm me. It's me time.
I love Netflix. I love shows, but I'm also a mom and a wife. So, I come home to my family and, even though people unload their emotions on me and, that's something that I endure during the day, I actually enjoy that because I'm helping them. And I have people specifically say, thank you for listening to me, or you're good at what you do because you actually listen to me. So even though they are unloading their emotions on me, I'm reassured in the fact that I am helping them. But yeah, then I come home. I sometimes have a little bit of a drive like today. So I'll listen to podcasts or I'll listen to my favorite playlist and just kind of unwind on the way home. And then when I get home, I spend time with my family. And
Boys.
and then the boys go to bed, and then my husband and I will like Netflix. So pretty normal things.
And I think what also helps us the flexibility of your work, right? Like hours wise, like we talk about with physicians, you don't need to be on call. You don't have to. I'm so sorry, but interventional cardiologists don't have a life. They are called at 4 a.m.
Either. Like I said, my sister-in-law's an orthopedic surgeon, and
Yeah.
always on call, always getting called in. And yeah, I have a very good, I don't like to say work-life balance because I feel like that's an oxymoron. That's not such thing.
Yeah.
But I don't work weekends. I don't work holidays. I work 4/10, so 7 to 5. But then when I get off, like I'm off.
That's it, right? And this is something like pre-nursing and nursing students need to know. I think it's common within the nursing field, right, where new grads are always, I guess, frustrated or whatnot to get bedside experience. You gotta work med surg first. You gotta be at bedside first. And we'll tell you right now, that's not.
No, that's what clinicals are for. They force you to do that. They force you to do that in clinicals.
And make you realize that that's not what you want to do, right?
And kudos to the people that will do that. I mean, it takes a special person, but I dreaded going to clinicals every day and running around just giving people medicine, giving them sponge baths. And there's a need for that. And the people that do that and enjoy doing that, you have a special place in my heart, but that is not for me. I went immediately to the NICU for a little bit less than a year. And then immediately people kind of tried to steer me away from derm because they were like, you need more hospital experience. You don't need to do an office setting. And now I have people messaging me, contacting me left and right. How do I get the job?
Yeah. And I knew this also as a nursing student, but for those who are well unaware, there is a life outside bedside in nursing. The beauty of nursing is how versatile this job is. You can work outpatient. You can work inpatient if you wanted to. You can work
behind a desk. Yes.
You can work as a traveling nurse.
In research.
You can teach if you want to. You can be in management or whatnot.
Yes.
There is a lot in nursing, and I'm glad you took that step and you're enjoying as a dermatology and helping people and helping patients and them change their lives and gain their confidence back. And I know you had the whole work day, so I really don't want to keep you because I know traffic as well. I want you to rest as well and have time with your boys before they go to sleep.
Yeah, well, I always love spending time with you. Thank you. You keep saying thank you for coming. Thank you for having me. We always go over because it's so fun.
I know.
But yeah, thanks for sticking in here with us for a whole hour.
Hey, this is so exciting. Thank you so much, Vanna. Have a good night.
Thank you, too.
Thank you. Bye.